Hello everybody, Dr. Aldin C. I'm founder of Pronto Care. Today we're talking about congestive heart failure. And I'm sure sometimes you came across a friend or family or neighbor or someone who have been named or diagnosed to have congestive heart failure. There's almost 6 million Americans who have congestive heart failure. There's about 550,000 new cases, almost 500,000 new cases every year in the United States, and there's close to 26 million cases globally. So congestive heart failure is very important. And the way we do it is that when the heart is unable to cope up with the demands of the body, as the heart is the pump that need to nourish the blood to all its vital organs, that in a sense it's called the heart failure. Heart failure comes in two flavors. One is called systolic heart failure, or weakening of the pump, where the pump is not working as strong as it should, and it becomes like a bag and it's very weak and it's not pumping blood effectively. So there's fluid all over the body. Patient cannot breathe. They cannot lay down. They wake up in the night choking. After laying 2 hours, called paroxysmal nocturnal dyspnea, and they have swelling in the leg edema, and of course with that the quality of life really become deteriorated. They can't do much. They can't walk a block or two without huffing and puffing and so on and so forth. So the admission and readmission to the hospitals are very, very high. So it's important, number one, to find the risk factors that will lead to the congestive heart failure and control it. And if it does, we need to early diagnosis and intervention to prevent the devastation, and again, repeated hospitalization and huge cost and loss of productivity, and a lot of overall reduction in the quality of life, as well as longevity. So number one, what is now that we know what the heart failure, the causes for heart failure? There's coronary artery disease, blockages in the coronary artery that supply blood flow to the heart muscle. That's number one. Number two, hypertension or high blood pressure that's uncontrolled, putting a lot of stress and strain on the heart to work extra time because of this extra weight that comes in from uncontrolled high blood pressure. Then comes arrhythmia. We talk about some arrhythmia like atrial fibrillation, where the heart does not have enough time when it goes fast to really rest and get the oxygen during what's called the rest period, called diastole, and that throw it into heart failure. And there are other less frequent causes like postpartum cardiomyopathy. If somebody after delivery, especially in women, they may have a weakness of the heart muscle, especially in African Americans, female, that could lead to persistent weakening of the heart muscle, and could lead to more or less congestive heart failure in younger adults. There are some other factors that can lead to congestive heart failure. It's called diastolic heart failure, where the heart muscle is really strong, but and it's when we measure it by what's called ejection fraction when we do an echocardiogram, because the echocardiogram is very critical in the way we manage congestive heart failure, get to know which way to identify the mechanism, as well as the pumping function of the heart. And diastolic heart failure is very common in elderly females who have high blood pressure, and the heart literally is too stiff to relax, and because it's too stiff to relax, it can lead to congestive symptoms, and similarly shortness of breath and fluid retention, and huffing and puffing and leg edema. So now that we found the heart failure, we need to identify the reason for it. Again, avoid all toxins. We discussed about alcoholic cardiomyopathy, or basically if you bring a drop of alcohol, put it on the heart muscle, it kills it, or makes dysmyopathy, meaning really weakness of the heart muscle. And there's millions of people in the United States who could benefit from alcohol cessation, basically when they have a toxicity or direct toxic effect on the heart muscle. That has to be addressed as a part of the therapy. And then of course you do all the proper testing, the echocardiogram, a sonogram of the heart, and then a stress test, whether nuclear or running, and then we may get further diagnostic tests like cardiac catheterization especially if the heart is weakened, what's called a weak or low ejection fraction, and that will lead us to find out about the blockage. Because if you fix the blockage by balloon stent, or if it's in one single artery, or bypass if it's a lot of blockages, the heart muscle, when it gets more blood flow, it can recover and get strong back again. Anyway, heart failure needs to be addressed, checked, and managed appropriately to prevent frequent hospitalization, and also a lot of devastations in the quality of life and foreshortened lifespan. Thank you.